The American Academy of Pediatrics updated its guidance for face masks in schools today, recommending that all staff and students who are older than 2 wear masks in schools.
And Dr. Allison Tothy is a pediatrician and president of the Illinois chapter of the American Academy of Pediatrics, and she joins us now to talk more about that announcement today. Doctor, thanks for being with us this afternoon.
Hi, thanks for having me.
The confusion that I can hear that sort of surfaces after hearing this, because there are some school districts that came out last week and said, we're going to make masks optional. It's going to be up to the parents to decide for their children. And then you come out with this recommendation. How do you square all of this and make it so people understand what's the right way to do this back in school?
It's incredibly complicated, but so is everything and all the advice that has been coming out. It feels like to parents and children that it's coming from all different directions, and it definitely isn't all the same advice. But the recommendation that the American Academy of Pediatrics put out earlier today is that all children, teachers, and staff above the age of 2, whether or not you're vaccinated, need to wear masks in the school buildings during school.
Okay, and I want you to explain the reasoning behind this, because obviously we've been hearing a lot of talk about the Delta variant that makes a lot of parents worried. Is that the main reason why you decided to make this recommendation?
So that's certainly one of the reasons, but the reality is that a lot of our children are not going to be vaccinated. They're not eligible to be vaccinated, and kids above 12 years of age, the 12 to 18-year-olds, a lot of them are not choosing to be vaccinated, even though we're recommending the vaccine to anyone where it's available. So because of that, we're trying to protect absolutely everyone that is in school. School is just so important. We have to get kids back into the buildings, back into school, not just for the education piece, which is incredibly important, but the social component to it and the mental health component as well.
Yeah, I was going to take note of that. It struck me reading your position on this that you strongly recommend in-person learning for the reasons that you just described. You also talk about a layered approach. What are some of the other layers that you would recommend that school administrators take to keep the kids as healthy as possible?
So that's a great question. And the layered approach really isn't any different to what we've been already doing, which is the component of social distancing when possible, hand hygiene, encouraging really good ventilation in the school system, in the school buildings, and then masking as well. And obviously, keeping your children home if they are sick or they have any symptoms, and teachers doing the same, staying home if they're sick as well.
I know. A lot of people, though, are considering, is it safer to maybe keep the kids at home? At what point would you then make the leap and recommend that we go back to remote learning? Is that something that you've talked about and that you've been considering?
No, masks work. It's part of our safety plan with keeping people safe from COVID-19. So masks work. We just need to use them. And so if we have kids and teachers in the classroom that are wearing masks, we know that we can have them back in person safely.
Will you feel differently about this when the CDC makes the vaccinations eligible for kids under 12? How does that change the whole dynamic?
So I am so looking forward to the time when everyone is eligible for a vaccine. But that doesn't mean that everyone will get the vaccine. There are a lot of areas that have really low rates of uptake with regards to obtaining the vaccine and choosing to take it. So we know that there can't be a one-size-fits-all for the solution right now, because people aren't choosing to vaccinate. And as a result, we have to think of the other safety measures that we need to put in place.
Dr. Allison Tothy with the Illinois chapter of the American Academy of Pediatrics. Thanks for doing your best to clear all that up for us. We really appreciate it.
Thank you.
Have a good afternoon.